Fitwell, always well.
Heart attacks remain as one of the major concerned health problems around the world. It is often caused by something called blood thickening. Before we could see how magnets are involved in reducing the rate of heart attacks, let's first see what blood thickening is and how it leads to heart attack. The thick bloods so formed will create a friction against the walls of the blood vessels, gets itself secreted in the walls, thus blocking the way for other bloods to flow. This blood thickening may either occur from birth or develop later in our life. It may be caused due to some foods, drugs, and various other medical conditions. Often, this blood thickening leads to blood clots in the veins of our legs, and this special condition, we call it as venous thrombosis. They can also result in blocking the way of lungs, leading to a major problem called pulmonary embolism. And in addition to the veins, blood thickening can also occur in the arteries. One such blood thickening occurs in the artery of the neck, blocking the blood going to the brain. This ultimately results in the stroke. And if such blood thickening occurs at the arteries of heart, it will result in heart attacks. This blood thickening may be due to several diseases and conditions such as lupus, protein C and protein S deficiency, which is the inability to activate the factors 5 and 8, the antithrombin deficiency, and some genetic mutations, particularly the mutations of factor 5 called prothrombin. This blood thickening can be treated by drugs such as aspirin, Plavix, heparin, and coumadin. Aspirin and Plavix helps to make the blood platelets less sticky, but in turn heparin and coumadin slows down the blood clotting system. Let's now get into our main topic. This is a famous professor named Ranjia Tao, who is working as a chair and professor of physics at Temple University. Back in 2011, he and his co-workers worked on the ways to reduce heart attacks by applying magnetic field, and he successfully did so by reducing the blood's viscosity by around 30%. He did this by subjecting a magnetic field of about 1.3 Tesla for about 1 minute. This amount of magnetic field is same as the one that is generated by the MRI scans. He and his co-workers worked on many blood samples and found that subjecting magnetic field to these blood samples polarizes the red blood cells. This polarization is more similar to polarizing the electropositive and electronegative elements, where the electropositive elements acquires partial positive charge and the electronegative elements acquires the partial negative charge. Thus, these red blood cells on polarizing gives a linear straight chain. This linear straight chain will flow along the center of the blood vessels, thus reducing the contact of the walls of the blood vessels, and in turn reduces the risk of heart attacks. And this method of magnetorheology provides an effective way to control the blood's viscosity. Magnetorheology is nothing but rheology is some term referring the viscosity, and magnetorheology is the term referring to the reduction of viscosity by applying a magnetic field. And Tao himself said that applying magnetic field is not only safer but also repeatable. The blood thinners, which I have mentioned earlier, like aspirin, Plavix, etc., give side effects. It must be consumed for at least 6 months for patients, and in some special cases, the patients must consume for a longer period to prevent further blood clots. But applying magnetic field is safer, and it is also repeatable. We can also reduce the viscosity again and again if blood clots occurs again. And in addition to all these, viscosity reduction will not affect the normal function of red blood cells. Hence, reduction in viscosity by applying magnetic field plays a major role in reducing the
Fitwell BIO-Magnetic mattress, always well